Hello guys, welcome to my channel Twastramanas. In the intricate landscape of career choices, navigating the path to a fulfilling and successful career can be a daunting task. This is where the invaluable guidance of career counselling comes into play. Career counselling employs a variety of stages, models, and tools to assist individuals in exploring their interests, skills, values, and goals, ultimately helping them make informed career decisions. Let's delve into the depths of career counselling and uncover the essence of each stage, model, and tool, along with real-world examples illustrating their application. 1. Exploration stage. The exploration stage sets the foundation for the career counselling process, encouraging individuals to reflect on their interests, values, personality traits, and skills. One widely used tool in this stage is the self-directed search, SDS, which helps individuals identify their Holland codes based on their preferences for certain work environments and activities. For example, a recent college graduate, uncertain about their career path, might take the SDS assessment and discover a strong preference for investigative tasks, guiding them towards careers in research or analysis. 2. Assessment stage. In the assessment stage, career counselors utilize various assessment tools to gather information about clients' aptitudes, abilities, and career-related preferences. The Myers-Briggs Type Indicator, MBTI, is a prominent tool used to assess personality types, providing insights into how individuals perceive the world and make decisions. For example, an individual with an ENFJ personality type, characterized by strong interpersonal skills and a desire to help others, might be drawn to careers in counseling, teaching, or human resources. 3. Goal setting stage. Once individuals have explored their interests and assessed their abilities, the goal-setting stage comes into play, helping them articulate their career aspirations and establish achievable goals. The SMART goal-setting framework, which emphasizes goals that are specific, measurable, achievable, relevant, and time-bound, is often employed in this stage. For instance, a mid-career professional aiming to transition into a leadership role might set a SMART goal to complete a relevant certification within the next 6 months, paving the way for career advancement. 4. Decision-making stage. The decision-making stage is where individuals weigh their options, considering factors such as job prospects, salary potential, work-life balance, and personal values. One model frequently used in this stage is the expected utility theory, which posits that individuals make rational decisions by assessing the expected outcomes and probabilities associated with each option. For example, a recent graduate deliberating between job offers may use this model to evaluate the potential long-term benefits and drawbacks of each opportunity before making a decision. 5. Action planning stage. In the action planning stage, individuals translate their career goals into actionable steps, developing a strategic plan to achieve their objectives. The GROW model, which stands for Goal, Reality, Options, and Will, provides a structured framework for setting objectives and identifying the necessary actions to accomplish them. For instance, an aspiring entrepreneur utilizing the GROW model might set a goal to launch a startup within the next year, assess the current market reality, explore funding options, and commit to taking consistent action towards building their business. 6. Implementation stage. The implementation stage is where individuals put their action plans into motion, taking concrete steps towards realizing their career aspirations. Career counselors often provide support and encouragement during this stage, helping clients navigate challenges and stay focused on their goals. For example, a professional undergoing a career transition might leverage networking opportunities, attend industry events, and seek mentorship to facilitate their journey towards a new role or industry. 7. Evaluation stage. Finally, the evaluation stage involves reflecting on progress, reassessing goals, and making any necessary adjustments to the career plan. One tool commonly used in this stage is the SWOT analysis, which helps individuals identify their strengths, weaknesses, opportunities, and threats in relation to their career objectives. For instance, a mid-career professional reassessing their career trajectory may conduct a SWOT analysis to identify areas for skill development, potential career advancements, and external factors that could impact their career path. Models of counseling. 1. Expected utility theory. Expected utility theory is a model frequently employed in the decision-making stage of career counseling. It posits that individuals make rational decisions by assessing the expected outcomes and probabilities associated with each option. This model helps individuals evaluate various career opportunities based on factors such as job prospects, salary potential, work-life balance, and personal values. For example, a recent graduate may use expected utility theory to weigh the potential long-term benefits and drawbacks of different job offers before making a decision. Example: Sarah, a recent graduate, is considering 2 job offers. Job A offers a higher salary but requires extensive travel, while Job B offers a lower salary but provides opportunities for professional development and a better work-life balance. By applying expected utility theory, Sarah evaluates the potential outcomes and probabilities associated with each option. She considers the long-term impact on her career growth, personal well-being, and job satisfaction before making her decision. 2. GROW model. The GROW model, which stands for Goal, Reality, Options, and Will, provides a structured framework for setting objectives and identifying the necessary actions to achieve them. This model is often utilized in the action planning stage of career counseling, where individuals translate their career goals into actionable steps. For instance, a professional seeking to advance their career might use the GROW model to set specific goals, assess the current reality of their situation, explore available options, and commit to taking concrete actions towards their objectives. Example: John, an experienced professional, is feeling stagnant in his current role and desires career advancement. Using the GROW model, John sets a specific goal of obtaining a leadership position within his organization. He assesses the reality of his current skill set and identifies areas for improvement. John explores various options for career advancement, such as pursuing additional training or seeking mentorship. With a clear action plan in place, John takes proactive steps towards achieving his goal, including networking with senior leaders and taking on challenging projects to demonstrate his leadership potential. 3. SWOT analysis. The SWOT analysis is a tool commonly used in the evaluation stage of career counseling. It helps individuals identify their strengths, weaknesses, opportunities, and threats in relation to their career objectives. This analysis enables individuals to gain a comprehensive understanding of their internal capabilities and external factors that may impact their career path. For example, a mid-career professional conducting a SWOT analysis may identify opportunities for skill development, potential career advancements, as well as external threats such as industry disruptions or economic downturns. Example: Emily, a marketing manager, conducts a SWOT analysis to evaluate her career prospects. She identifies her strengths in strategic planning and project management, along with weaknesses in digital marketing skills. Emily recognizes opportunities for career growth within her industry, such as expanding into new markets or specializing in emerging technologies. However, she also acknowledges threats such as industry competition and economic uncertainty. By leveraging her strengths and addressing her weaknesses, Emily develops a plan to enhance her digital marketing expertise and capitalize on opportunities for career advancement. Tools of counseling. 1. Self-directed search, SDS. The self-directed search, SDS, is a widely used tool in the exploration stage of career counseling. It helps individuals identify their Holland codes, which are based on their preferences for certain work environments and activities. For example, a recent college graduate, unsure about their career path, may take the SDS assessment and discover a strong preference for investigative tasks, guiding them towards careers in research or analysis. Example: Alex, a college student, is undecided about his career path. He takes the self-directed search, SDS assessment and discovers a strong preference for investigative and artistic activities. Based on his results, Alex explores career options in fields such as graphic design, architecture, and forensic science. He conducts informational interviews with professionals in these fields and participates in internships to gain hands-on experience and clarify his career goals. 2. Myers-Briggs Type Indicator, MBTI. The Myers-Briggs Type Indicator, MBTI, is a prominent tool used in the assessment stage of career counseling. It assesses personality types and provides insights into how individuals perceive the world and make decisions. For instance, an individual with an ENFJ personality type, characterized by strong interpersonal skills and a desire to help others, might be drawn to careers in counseling, teaching, or human resources. Example: Sarah, a recent graduate, takes the Myers-Briggs Type Indicator, MBTI assessment, and discovers that she has an ENFP personality type. Sarah learns that ENFPs are creative, energetic, and value autonomy in their work. Armed with this insight, Sarah explores career options that align with her personality traits, such as advertising, event planning, or entrepreneurship. She seeks out opportunities that allow her to express her creativity, collaborate with others, and make a positive impact on her community. 3. SMART Goal Setting Framework. The SMART Goal Setting Framework is utilized in the goal-setting stage of career counseling. It emphasizes setting goals that are specific, measurable, achievable, relevant, and time-bound. For example, a mid-career professional aiming to transition into a leadership role might set a SMART goal to complete a relevant certification within the next 6 months, paving the way for career advancement. Incorporating these models and tools into career counseling sessions empowers individuals to make informed decisions, set achievable goals, and navigate their career paths with clarity and confidence. By leveraging these resources, career counselors can support their clients in exploring their interests, assessing their abilities, and ultimately pursuing fulfilling and rewarding career opportunities. Example: Mark, a sales professional, sets a SMART goal to increase his sales performance by 15% within the next quarter. He outlines specific strategies to achieve this goal, including expanding his client base, improving product knowledge, and refining his sales pitch. Mark tracks his progress regularly, adjusting his approach as needed to stay on track towards achieving his goal. By applying the SMART framework, Mark maintains focus, accountability, and motivation to succeed in his sales career. Introduction. Substance abuse counseling is a vital field that aims to assist individuals struggling with addiction to substances such as alcohol, drugs, or prescription medications. It encompasses a range of therapeutic approaches, stages, models, and tools designed to support individuals in overcoming addiction and reclaiming their lives. In this comprehensive guide, we will delve into the various aspects of substance abuse counseling, exploring the stages of counseling, prominent counseling models, and essential tools utilized in the field. Stages of substance abuse counseling. 1. Assessment stage, in-depth evaluation. This phase involves a thorough examination of the client's substance use history, including frequency, duration, and quantity of substance consumption. Additionally, counselors explore the client's medical history, family dynamics, social support systems, co-occurring mental health disorders, and any past experiences with treatment. Through detailed assessments, counselors gain insight into the client's strengths, challenges, and readiness for change. Screening instruments. Counselors may utilize standardized screening tools such as the Substance Abuse Subtle Screening Inventory, SASI, Addiction Severity Index, ASI, or Drug Abuse Screening Test, DST, to gather quantitative data and identify specific areas of concern. These instruments help counselors to objectively assess the severity of substance use disorders and tailor treatment plans accordingly. Establishing rapport. Building a therapeutic alliance is paramount during the assessment stage. Counselors establish trust and rapport with clients by by demonstrating empathy, active listening, and non-judgmental attitudes. Creating a safe and supportive environment encourages clients to disclose sensitive information and actively engage in the counseling process. Collaborative goal setting. Through collaborative discussions, counselors and clients establish mutually agreed upon treatment goals based on the client's desires, strengths, and priorities. Setting realistic and achievable goals enhances client motivation and fosters a sense of ownership and commitment to the therapeutic process. Example: during an assessment, a counselor may conduct interviews, administer questionnaires, and review medical records to gain a comprehensive understanding of the client's substance use. 2. Treatment planning. Stage individualized care plans. Treatment plans are tailored to address the unique needs, preferences, and circumstances of each client. Counselors draw upon assessment findings, clinical expertise, and evidence-based practices to develop comprehensive care plans that encompass various domains, including medical, psychological, social, and spiritual dimensions. Holistic approach. Effective treatment plans adopt a holistic approach that considers the interconnectedness of physical, emotional, cognitive, and environmental factors influencing substance use behaviors. Integrating interventions such as medication-assisted treatment, MAT, individual therapy, group therapy, family therapy, and adjunctive services ensures a multifaceted approach to recovery. Strengths-based perspective. Recognizing and harnessing the client's inherent strengths, resilience, and support systems is integral to treatment planning. Empowering clients to leverage their strengths and external resources fosters self-efficacy, self-determination, and resilience in overcoming challenges associated with substance abuse. Continuum of care. Treatment plans outline a continuum of care that addresses clients' evolving needs across different stages of recovery. From detoxification and stabilization to relapse prevention and aftercare services, counselors coordinate a seamless transition between levels of care to optimize treatment outcomes and long-term recovery. Example: a counselor may work with a client to identify triggers for substance use and develop coping strategies to manage cravings and avoid relapse. 3. Intervention stage. Evidence-based interventions. Counselors employ a repertoire of evidence-based interventions tailored to address the specific needs and goals of clients. These interventions may include cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, motivational interviewing, MI, contingency management, and 12-step facilitation programs. Psychoeducation. Educating clients about the neurobiology of addiction, the cycle of change, and coping strategies enhances their understanding of substance use disorders and equips them with essential knowledge and skills for recovery. Psychoeducation also addresses common misconceptions, stigma, and barriers to seeking help. Skill building. Clients acquire and practice coping skills, emotion regulation techniques, and problem-solving strategies to manage cravings, cope with stressors, and navigate high-risk situations without resorting to substance use. Skill-building exercises empower clients to develop adaptive behaviors and enhance their resilience in the face of triggers and temptations. Relapse prevention. Anticipating and effectively managing relapse is a critical component of intervention. Counselors collaborate with clients to identify triggers, early warning signs, and coping mechanisms to prevent relapse and maintain long-term sobriety. Relapse prevention plans incorporate personalized strategies, social support networks, lifestyle modifications, and emergency action plans to mitigate the risk of recurrence. Example: counselors may utilize cognitive behavioral therapy, CBT, motivational interviewing, MI, group therapy, or family therapy to address underlying issues contributing to substance abuse. 4. Monitoring and evaluation stage. Ongoing assessment. Regular monitoring of client progress allows counselors to track changes in substance use behaviors, mental health symptoms, and psychosocial functioning over time. Objective measures, self-report assessments, and collateral information from collaterals inform the ongoing evaluation of treatment effectiveness and guide modifications to the care plan as needed. Outcome measurement, evaluating treatment outcomes, involves assessing the achievement of predefined goals and objectives related to substance use reduction, improved quality of life, and enhanced functional impairment. Outcome measures may include abstinence rates, relapse rates, improvements in psychiatric symptoms, social functioning, and client satisfaction with treatment. Treatment adherence, monitoring client adherence to treatment recommendations, medication regimens, and therapeutic interventions is essential for optimizing treatment outcomes and preventing dropout or disengagement from services. Identifying barriers to treatment adherence and addressing client concerns or ambivalence promotes treatment, retention, and continuity of care. Feedback and collaboration. Soliciting feedback from clients about their experiences with treatment, perceived benefits, and areas for improvement fosters a collaborative and client-centered approach to evaluation. Regular communication and collaboration between counselors, clients, interdisciplinary treatment teams, and external stakeholders facilitate comprehensive assessment and continuous quality improvement in substance abuse counseling services. Example: counselors may regularly assess the client's substance use behaviors, mental health symptoms, and overall functioning to gauge the effectiveness of interventions and modify the treatment plan accordingly. Prominent counseling models in substance abuse. Counseling. 1. Biopsychosocial model. Biological factors, genetic predispositions, neurobiological alterations, and pharmacological mechanisms contribute to the development and maintenance of substance use disorders. Understanding the biological underpinnings of addiction informs targeted interventions, medication management, and harm reduction strategies tailored to individual needs. Psychological factors, psychological vulnerabilities, cognitive distortions, emotional dysregulation, and maladaptive coping mechanisms play a significant role in the etiology and perpetuation of substance abuse. Addressing underlying psychological issues through psychotherapy, cognitive restructuring, and emotion-focused interventions promotes sustainable recovery and emotional well-being. Social factors, socio-environmental influences, interpersonal relationships, socioeconomic status, cultural norms, and social support networks influence patterns of substance use and treatment outcomes. Interventions targeting social determinants of health, family dynamics, peer influences, and community resources enhance clients' social connectedness, resilience, and recovery capital. Integrated treatment approach. The biopsychosocial model advocates for an integrated treatment approach that addresses biological, psychological, and social dimensions of substance use disorders concurrently. Coordinated care delivery, interdisciplinary collaboration, and holistic interventions maximize treatment effectiveness and support long-term recovery. Example: a counselor using this model would consider genetic predispositions, psychological vulnerabilities, and social environments when assessing and treating substance use disorders. 2. Stages of change model, trans-theoretical model, pre-contemplation. Stage. Clients in this stage are not yet considering change and may exhibit denial, resistance, or minimization of their substance use problems. Motivational interventions focus on raising awareness, increasing ambivalence, and exploring the pros and cons of change to stimulate contemplation. Contemplation stage. Clients in this stage are aware of the need for change, but may feel conflicted or uncertain about taking action. Motivational interviewing techniques facilitate exploration of personal values, goals, and motivations for change, thereby enhancing readiness and commitment to treatment. Preparation. Stage. Clients in this stage are actively planning and preparing for change, often seeking information, support, and resources to facilitate their efforts. Collaborative goal setting, problem solving, and decision-making strategies empower clients to overcome barriers and take concrete steps toward behavior change. Action stage. Clients in this stage are actively engaged in modifying their substance use behaviors and implementing coping strategies to achieve their treatment goals. Skill-building exercises, relapse prevention planning, and social support networks reinforce positive changes and promote sustained abstinence. Maintenance stage. Clients in this stage are focused on consolidating gains, maintaining lifestyle changes, and preventing relapse over the long term. Ongoing support, monitoring, and coping skills practice help clients navigate challenges, cope with stressors, and reinforce positive habits to sustain recovery. Relapse prevention. Stage. Clients in this stage have experienced setbacks or lapses in their recovery journey and require targeted interventions to identify triggers, address underlying issues, and re-engage in treatment. Relapse prevention planning, crisis management, and adaptive coping strategies promote resilience and facilitate reintegration into recovery-oriented activities. Example: a counselor working with a client in the contemplation stage might focus on increasing awareness of the consequences of substance use and exploring ambivalence about change. 3. Cognitive behavioral model, cognitive restructuring, cognitive behavioral therapy, CBT, targets maladaptive thoughts, beliefs, and attitudes that contribute to substance use behaviors. Clients learn to identify and challenge irrational cognitions, cognitive distortions, and cognitive biases that reinforce addictive patterns and undermine recovery efforts. Behavioral modification. Behavioral interventions focus on modifying reinforcement contingencies, learning principles, and environmental cues associated with substance use. Clients acquire adaptive coping skills, problem-solving strategies, and assertiveness training techniques to replace addictive behaviors with healthier alternatives. Functional analysis. Functional analysis helps clients identify antecedents, behaviors, and consequences of substance use episodes to understand the function or purpose they serve. By examining triggers, cravings, and coping responses, clients gain insight into the contextual factors driving their addictive behaviors and develop personalized relapse prevention strategies. Skill acquisition. Cognitive behavioral therapy emphasizes skill acquisition and rehearsal to enhance clients' ability to cope with high-risk situations, manage cravings, and navigate interpersonal challenges without resorting to substance use. Role-playing, modeling, and experiential exercises facilitate skill development and promote generalization to real-world settings. Example: a counselor employing cognitive behavioral techniques might help a client identify and challenge irrational thoughts and develop alternative coping skills to manage cravings and triggers. 4. Motivational enhancement. Therapy, client-centered approach. Motivational enhancement therapy, MET, adopts a client-centered, collaborative approach that honors clients' autonomy, strengths, and intrinsic motivations for change. Counselors evoke and amplify clients' inherent readiness, confidence, and commitment to pursuing healthier behaviors and values. Exploring ambivalence. Motivational interviewing techniques help clients explore and resolve ambivalence about change by examining the pros and cons of their current substance use behaviors. By eliciting discrepancies between clients' goals and behaviors, counselors stimulate cognitive dissonance and facilitate motivation for change. Developing discrepancy. MET encourages clients to articulate their aspirations, values, and long-term goals, highlighting discrepancies between their current behaviors and desired outcomes. By enhancing awareness of the disparity between where clients are and where they want to be, counselors evoke a sense of cognitive dissonance and motivation for change. Building self-efficacy. MET fosters clients' self-efficacy and confidence in their ability to overcome challenges, cope with setbacks, and achieve their treatment goals. Through collaborative goal setting, problem solving, and skills training, clients develop a sense of mastery and empowerment in navigating the recovery process. Example: a counselor using motivational enhancement therapy might explore the client's values, goals, and aspirations to increase their motivation to reduce or abstain from substance use. Essential tools in substance abuse counseling. 1. Motivational interviewing. Expressing empathy. Motivational interviewing, MI, begins with the counselor expressing empathy and understanding toward the client's experiences, feelings, and perspectives. By adopting a non-judgmental, empathic stance, counselors create a safe and supportive atmosphere conducive to open dialogue and self-exploration. Developing discrepancy, MI techniques help clients recognize and resolve discrepancies between their current behaviors and their values, goals, and aspirations. By eliciting and amplifying ambivalence about change, counselors evoke clients' intrinsic motivations and enhance their readiness for behavior change. Rolling with resistance. MI acknowledges and respects clients' autonomy, resistance, and reluctance to change. Rather than confronting or challenging resistance directly, counselors adopt a collaborative, non-confrontational approach that validates clients' perspectives and encourages exploration of alternative viewpoints. Supporting self-efficacy. MI aims to bolster clients' self-efficacy and confidence in their ability to change by highlighting past successes, strengths, and coping resources. Through affirmations, reflective listening, and positive reinforcement, counselors cultivate a sense of hope, optimism, and empowerment in clients' recovery journey. Example: a counselor using motivational interviewing might employ open-ended questions, reflective listening, and affirmations to evoke the client's intrinsic motivation for change. 2. Relapse prevention planning. Identifying triggers. Relapse prevention planning involves identifying high-risk situations, internal cues, and external triggers that may precipitate substance use, cravings, or relapse. Clients learn to recognize early warning signs such as stress, negative emotions, interpersonal conflicts, or environmental cues, and develop coping strategies to manage these triggers effectively. Coping skills. Development. Clients acquire a repertoire of coping skills, relaxation techniques, and stress management strategies to cope with triggers and cravings without resorting to substance use. Cognitive behavioral techniques, mindfulness practices, and assertiveness training empower clients to respond adaptively to challenging situations and maintain abstinence. Social support networks. Building and mobilizing social support networks is crucial for relapse prevention. Clients identify supportive individuals, recovery-oriented communities, and peer networks that can provide encouragement, accountability, and practical assistance in times of need. Strengthening social connections reduces feelings of isolation and enhances resilience in recovery. Lifestyle modifications. Adopting healthy lifestyle habits, routines, and recreational activities promotes overall well-being and reduces the risk of relapse. Clients engage in regular exercise, nutrition planning, sleep hygiene practices, and leisure pursuits that enhance physical health, emotional balance, and self-care in recovery. Example: a counselor might work with a client to create a relapse prevention plan that includes coping skills, social support networks, and healthy lifestyle choices to maintain sobriety. 3. Psychoeducation, understanding addiction. Psychoeducation provides clients with accurate information about the nature of addiction, its neurobiological underpinnings, and its impact on physical, psychological, and social functioning. By dispelling myths, misconceptions, and stigma surrounding substance use disorders, clients gain insight into their condition and feel empowered to seek help. Learning coping strategies. Psychoeducation equips clients with practical coping strategies, problem-solving skills, and emotion regulation techniques to manage cravings, triggers, and stressors without resorting to substance use. Clients learn to identify early warning signs, implement harm reduction strategies, and access appropriate support resources in times of need. Exploring treatment options. Psychoeducation educates clients about available treatment options, including outpatient counseling, residential rehabilitation, medication-assisted treatment, MAT, mutual support groups, and complementary therapies. Informed decision-making and treatment engagement are facilitated by providing clients with information about the benefits, risks, and alternatives to various interventions. Preventing relapse. Psychoeducation on relapse prevention helps clients anticipate common relapse triggers, recognize warning signs of impending relapse, and implement proactive strategies to maintain sobriety. By understanding the cyclical nature of addiction and the importance of ongoing self-care and support, clients develop realistic expectations and strategies for long-term recovery. Example: a counselor might educate clients about the neurobiology of addiction, the cycle of addiction, and available resources for recovery. Thank you for your time, and I hope you liked the video. Please share, subscribe, and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.